Hi, I'm Marissa Distel, and I will be demonstrating a female Foley catheter insertion. I will begin my procedure by hand hygiene, and I will check the order because there's many reasons for inserting catheters. I will make sure I have all my supplies near me. I will then look to see what type of catheter I will be inserting, which is a 14 French, which is appropriate for my patient. I will then knock on the door and introduce myself. Hello, Mrs. Olson. My name is Marissa. I will be your nurse today, inserting a Foley catheter, and I will explain why and ask the patient if she has any questions. I will then check for 2 patient identifiers. I will ask my patient, Mrs. Olson, can you please recite your full name for me and your date of birth? I will then check her bracelet if she has one. I will then expose the perineum. And try to keep my patient as covered as I can. And then I will place my patient in the lithotomy position with the knees up, and I will assist my patient if needed. Knees up, and then my patient flat as possible, and if they're comfortable. I will then open up my bag and start. Then I will shake and make sure the shiny side is facing towards my patient. Then I will go place it, and I can fix it when my gloves are on. Now I will be putting my sterile gloves on. Making sure to keep my hands above my waist. And now I can fix my placement without contaminating my gloves. And I won't be needing this, so I can dispose this. And now I can open up my betadine sticks. And I will open up my lube. Place in the container. And now I will take my box and separate them. And now I will test the balloon to make sure it inflates. I will test it with 5 cc's of water. And it inflates, so that's good. We'll then and place it back in the box. And I'm not sure if I said this in the beginning, but I would perform peri-cares if they weren't done. And then now I will contaminate my left hand, and I will clean the area with the betadine sticks. I will go from front to back on one side, and then front to back on the other side, and down the middle, front to back. I will now grab my catheter and I will put some lube on it. And I will tell the patient you might feel a little pressure, and I will insert 3 to 4 inches or until I see urine, and then I will go in an inch further and I see urine. So I went in an inch further, and now I'm going to pinch with my contaminated hand, and I will insert my sterile water. I will now grab with my contaminated hand, I'll yank back to make sure it's, give it a little yank just to make sure it's in there. And I will take my contaminated hand and I will wrap this around, remove my syringe, and now I have done a sterile Foley cath insertion. But now I will dispose of my garbage with my gloves. I will make sure not to touch the bag. And I will remove my sterile gloves, and I will put on a clean pair of gloves. And I will ask the patient if they're feeling any discomfort and for anything, and I will strap the bag to the patient's leg, leaving it towards the end, leaving it a little flexible so they have room to move. And I don't have a cath strap on, but I would strap it down here. And then I would place the bag in a non-movable part on the bed, and I will twist my tubes and place them on top of the bed. And then I will check back with the patient to make sure there's urine flowing and to make sure they're not feeling any discomfort. Thank you.